In an infant, that microbe, Bifidobacterium infantis, is extremely important. We have thousands of different species, but in an infant, a newborn infant, that infantis can occupy up to 80% of the entire gastrointestinal microbiome. So it's very, very important. Now, after a year of life, it starts to change. So restoring that microbe, if that baby did not get it from mom, because moms have lost it too. They've taken antibiotics. I have a daughter-in-law who got 5 courses of antibiotics during her last trimester and after delivery, but replacing infantis because she lost it, can't give it up to her baby. That's a real important one. Another one is to start to restore some of the very important species. So Lactobacillus reuteri is one of them. Another one is Lactobacillus gasseri. By the way, we make a yogurt. I call it SIBO yogurt. It's Lactobacillus gasseri, the BNR17 strain, Lactobacillus reuteri, the 6475 strain, and a strain of Bacillus coagulans. We co-ferment them 36 hours, get super duper high, hundreds of billions of counts, and that has been working extraordinarily well, far beyond my expectations. Well, so far, and this is anecdote, not a clinical study, of about 40 people who've done this, the SIBO yogurt, 90% have normalized their breath hydrogen gas, the stuff we're measuring, which was, I was hoping maybe 30% would respond. I did not expect 90. So we will perform a formal clinical trial to prove it. But so far, it's been working really well. And I think the reason why it works is because especially gasseri and reuteri are unique in that they colonize this upper intestine, small intestine. That's where SIBO occurs. And they are very good at producing what are called bacteriocins. These are natural antibiotics effective against the species of SIBO, fecal microbes. So that's been working really well. And people are saying, yeah, I did the SIBO yogurt for 4 weeks, typically 4 weeks. I normalized my breath hydrogen gas, and I finally broke my weight loss plateau, or my waist shrunk dramatically, or my hemoglobin A1C, reflecting blood sugar, finally dropped into the ideal range, or some residual health problem finally went away. The mother must supplement omega-3 fatty acids because that delays premature delivery. It's been shown repeatedly, and the studies have been done. Ladies can take 2,000 or 3,000 milligrams of EPA and DHA per day safely. It doesn't cause hemorrhage. That's nonsense. A woman should be assessed for vaginal dysbiosis by a well-informed OB. Unfortunately, I often don't do that, but if they do, you can simply get Lactobacillus crispatus. There's one commercial probiotic I'm aware of that includes that, and it's called, once again, no relationship to that company. It's called Gyrodophilis. I think Gyrodophilis woman or female, one of the two. But look for Lactobacillus crispatus. That's real important. Another thing is the woman should not be overweight or insulin resistant. That has major implications for the health of the baby and mom. Well, how do you do that? The doctor says take drugs, take metformin, take these other drugs. I say no. Address the diet and nutrients that are lacking that reverse insulin resistance. So it's the basic stuff. No wheat, no grains, no sugars, because they raise blood sugar and insulin. Address common nutrient deficiencies that amplify insulin resistance, magnesium, omega-3 fatty acids, iodine, and vitamin D, and address your microbiome, your gastrointestinal microbiome, especially if you have SIBO, because that also contributes to insulin resistance. This is a problem for ladies with polycystic ovary syndrome, for instance. These are ladies who are very prone to high blood pressure, high triglycerides, diabetes and prediabetes, facial hair and hair elsewhere, higher testosterone, and are typically infertile. So they do this to reverse insulin resistance, diet, those nutrients, address bowel flora, and they're happy moms now. They're fertile, and they're no longer hypertensive. They're no longer pre-diabetic. They no longer have high testosterone. In other words, we're not going to treat those things. We're going to address the factors that allowed it to emerge in the first place. Same thing with a pregnant woman or woman contemplating pregnancy. Don't think you're going to treat things. Address the factors that allowed problems like miscarriage or premature delivery to emerge.
Don't hesitate to pass on the knowledge and hit the subscribe button on our channel for more practical health insights.